Hi everyone, here's an info boost about boosters. After a lot of back and forth last week, the CDC director signed the following booster recommendation for those who have received a Pfizer primary series. And remember that Pfizer primary series has to be 6 months from their second dose. So number 1, people 65 years and older and residents in long-term care settings should receive a booster. People aged 50 to 64 with certain underlying medical conditions should receive a booster. People 18 to 49 who are at high risk for severe COVID-19 due to certain underlying medical conditions may receive a booster based on their individual benefits and risks. And then number 4, people aged 18 to 64 years who are at increased risk for COVID-19 exposure and transmission because of occupational or institutional setting may receive a booster based on their individual benefits and risks. Note that the first 2 categories have a should recommendation, and the last 2 categories have a may recommendation. This refers to the strength of the data behind the recommendation, which is why individual benefit and risk should be considered for younger individuals with chronic medical conditions, as well as those with occupational exposure. Dr. Walensky thought it was important to open up boosters to high-risk occupations like healthcare workers, even though the ACIP wanted to work on the language a little bit more. It's important to highlight that in order to expand access to the booster as much as possible, CDC is recommending self-attestation of eligibility, including the individual's medical history or occupational category. So they don't need a doctor's note and they don't need a prescription to prove that they're eligible. Also, importantly, no guidance has been given on what to do with people who received Moderna or J&J as their primary series. We will keep you updated on that. So occupations at increased risk for COVID-19 exposure and transmission include frontline essential workers and healthcare workers, as well as all the occupations listed here. Note the frontline worker categories include teachers, public transit workers, and grocery store workers. Underlying conditions that are eligible is the same list of conditions that give you a higher risk of severe outcomes from COVID-19, a list you should be familiar with. But remember, there are should and may categories, as noted in the title of the slide. If you are 50 to 64 with these conditions, you should be vaccinated. There's good data for this. If you are 18 to 49 years old with these conditions, you may get a booster based off of your individual benefit and risk. The definition of being fully vaccinated has not changed with the booster dose, just as it didn't change with an additional dose in immunocompromised individuals. You give the booster the same way, it's the same dose, and you can give it with other vaccines. You don't need to wait any time between the COVID vaccine and another vaccine. Just remember that if you're co-administering with a highly reactogenic vaccine, like high-dose flu vaccine, for example, give the vaccines in separate arms. So let's look at the Chicago data. As of September 30th, 84,000 seniors are already eligible to receive a booster of Pfizer, with another 37,000 estimated to be eligible by the end of October. So what is it for your clinic or patients? In order to estimate the possible volume of booster demand at your clinic, you should run a COVID immunization activity report in iCare. Select for date ranges according to your first 2 months of first and second doses to forecast the number of booster doses you may need to provide 6 months from their second dose. Chicago's weekly administration of third doses, as seen in iCare, has increased from an average 500 doses per day from August 13th to September 24th to an average of 1,245 doses per day after the booster was recommended. We'll continue to track this and give you updated information as it becomes available. Thanks for keeping Chicago safe, one vaccine at a time.